In 1932, the United States Public Health Service, in partnership with the Tuskegee Institute, began a study in Macon County, Alabama. Researchers recruited 399 black men who had syphilis and 201 who did not. The men who had syphilis were told they were being treated for bad blood, a local term used to describe a range of ailments. They were not told they had syphilis. They were not told they were in a research study designed to observe the natural progression of untreated syphilis in the human body. They were given placebos and ineffective treatments while researchers documented what the disease did to them over time. When penicillin was established as an effective cure for syphilis in 1947, the men in the study were deliberately not given it. Public health officials worked to ensure that men in the study were not drafted during World War II, which would have given them access to treatment. When local organizations offered penicillin to men in the area, researchers intervened to prevent the study participants from receiving it. The study continued for 40 years. It was not a secret within the public health system. It was presented at conferences. It was published in medical journals. Hundreds of people knew it was happening. The men continued to deteriorate. Some died from syphilis or its complications. Their wives were infected. Children were born with congenital syphilis. In 1972, Peter Buxton, a public health service venereal disease investigator who had raised concerns internally for years, leaked the story to journalist Jean Heller. It was published in July 1972 and caused immediate national outrage. The study was shut down. A class action lawsuit was filed on behalf of the men and their families. In 1974, the government settled for $10 million and a promise of lifetime medical benefits for survivors and their families. In 1997, President Bill Clinton issued a formal apology on behalf of the United States government. 8 survivors attended the ceremony at the White House. The last known survivor, Herman Shaw, died in 1999. The Tuskegee study did not happen in a different era of medicine where such things were normal. It happened in living memory. Its legacy includes a deep and historically grounded mistrust of the medical system among Black Americans that public health researchers continue to grapple with today.